Well, hi everybody, this is Sandy and welcome back to my channel, dedicated to helping you become your own health advocate one topic at a time. So today I'd like to talk about the ambulatory surgical center settings. Ambulatory surgical centers, meaning centers where you go ahead and have surgery and then you are discharged home for the evening, as opposed to places where you might stay overnight, which we associate more with hospitals. Now, hospitals do perform ambulatory surgeries, but for the purpose of this discussion, I'm talking about the ambulatory surgical center. So something that is non-hospital, not connected to a hospital, and usually freestanding. So full disclosure, I'm a nurse anesthetist. I've been one for close to 30 years now, and the vast majority of my career I have spent in the ambulatory center. I personally like it. I think it has a lot of advantages to offer patients. And what are those? So first of all, they tend to be a win-win financially for surgeons, patients, and insurance companies. So of course, a surgeon usually makes more money bringing a case to his or her own center rather than taking it to the hospital. Usually these centers are owned at least in part by surgeons, if not all. And while that surgeon makes more money bringing the case to his own center, the patients and the insurance companies usually pay less. Why? Because these centers try to compete with hospitals and therefore they set their fees at a competitive rate and everybody wins. Second thing I really like about ambulatory centers is that they tend to be staffed with people who are less the jack of all trades, but the masters of one. I think this is particularly true in centers that are narrow specialty. For example, like eye surgery centers or endoscopy centers, where people are just doing the same few, like narrow range of procedures over and over again, day after day. And you find in these places that there aren't very many things that happen that these people can't handle or that they feel uncomfortable with. You don't tend to hear things like, do we have a, or how do we, or where is the, it just tends to be more of a well-oiled machine in my experience. And then finally, one really nice thing about ambulatory centers is, frankly, they're not hospitals. So if you're not sick, there are many reasons you might not want to be in a hospital, okay? And particularly if you're not sick and you're having surgery. One thing that comes to my mind is infection risks. Now, any place needs to have some policy procedures in place for infection control, but there is just no doubt that a hospital is a far more risky place in terms of infections. And, some people are really scared of hospitals. And in my opinion, the ambulatory center is just a really nice option. Now, there have been some reports and there have been some concerns that have arisen lately about whether these centers are in fact safe. And so I'm going to get into that. I did dive into where that came from recently, and I have compiled a short list of things that you might want to discuss with your surgeon and maybe with your primary doctor. So where did these concerns come from recently? Well, in 2018, Kaiser Health News and USA Today published a report that had some very concerning facts in it. They found that over a 5-year period from 2013 to 2018, they found in excess of 260 deaths related to outpatient surgical centers. Now, while I find that concerning, my gut tells me it is a concerning number because usually these environments are reserved for pretty uncomplicated cases and pretty uncomplicated healthy patients. But that said, there are some indictments about this report that Kaiser put out, and the worst of which, in my opinion, is the fact that it is a piece of investigative journalism. It is not research. So investigative journalism tends to focus on individual cases, media-worthy cases, and things like that. And it doesn't really give you context that better research would give you. So did they do any research? Yes. In this report, they looked at over 12,000 records that were from state inspections and Medicare inspections. And that's why I do give this report some healthy respect. But 260 doesn't tell us any context. 260 out of how many? I'm sure we did millions of cases in these ambulatory centers in those 5 years. So whether 260 is, where it fits, how big a number it is in that total, I do not know. Not that every single life isn't important, but it doesn't allow us a basis for a comparison because we would have to know what percentage that is. And then we would be able to compare whether in that same number of anesthetics and surgeries across the board in all settings, whether we would expect to find 260 or more or less. So I do have some concerns about the fact that this was not really a good piece of research, but rather investigative journalism. That said, after I read it, and by the way, I will link the article in the description box below, I did feel that there were some things that were very concerning about it. I felt that, at least in some of these cases, the deaths were definitely unnecessary, offensive to me as a practitioner, and at least in part due to the fact that they were in an outpatient setting. Okay, now that was my opinion. So with all that said, I came up with, like I said, a list of 4 things that you might want to discuss with your surgeon and your primary doctor. Now, nothing I ever say on this channel is meant to substitute for any kind of medical advice. This advice isn't medical anyway, although I might mention certain medical conditions and certain kinds of surgical procedures. But this is just my opinion based on my experience and what I read in this report and what resonated with me based on what I have seen in ambulatory centers over the years. Okay, some things did resonate with me. So here's some things I think that you should think about and discuss. One is patient complexity. What does that mean? How complicated a health history do you have? That should factor into whether you are going to have that surgery in a surgery center. Now, obviously, I don't expect that I'm going to be able to teach that and have you evaluate the complexity of your own health, but rather I want you to try to get a sense of whether your health complexity is something that is of consideration to your surgeon and to the staff in that environment when you are talking about scheduling your procedure in their center. So at some point, let's say you are having a discussion about carpal tunnel release, such as a procedure you would be having done on your hand. Once you start talking about having the surgery at their place, there should be some shift in the discussion where the surgeon is discussing with you your own health history and maybe the medications you're taking or whether you've had surgeries before. But there should be some discussion that indicates you're more than just a body attached to this hand, okay? So another way you might know that the health complexity is something that they do take seriously is if they ask you to get a medical clearance. Not everybody should be getting a medical clearance. Not everybody has to get one. It's a judgment call. But usually patients are very annoyed when they're asked to get a medical clearance. It adds some time. It's another visit. It might mean some more tests. You know, what it means is we're sending you to your doctor and we're asking your primary doctor to either let us know that you're properly optimized and cleared for surgery, or if you need some other testing done, in which case let us know when we can schedule it. I know that's inconvenient, but I will say that I think it speaks volumes about your surgeon's integrity if your surgeon says that he or she wants a medical clearance, okay? It means I know that this is out of my realm, and I know that you as a whole patient are important, and I want to make sure that you are properly optimized to have surgery at my center. One way you might have this discussion if it doesn't come up is ask and say, do I need a medical clearance? And if the surgeon says no, you don't, it should be because something relating to the fact that you are very uncomplicated. You're having probably a very low risk procedure and you're a very uncomplicated patient. It should be something like, we don't require medical clearances here, or well, we'll write our own. Okay, a surgeon that writes his or her own medical clearance is, in my opinion, not somebody to see. So patient complexity. The second thing is a topic that I call accreditation and certification, and it's 3 prongs. So you'll want to ask, is your surgery center accredited by a third party? I'm gonna get so much flack about this one because those of us in the business don't always enjoy that accreditation process. It's a little thorn in our side, and yes, there's a little arbitrary rigor sometimes injected in and some unnecessary bureaucracy, but having that certification on the wall that says we're accredited by a third party, and I will put in the description box below what those parties might be, it's the only way to say to the patients, we have availed ourselves to some stiff scrutiny and we've passed. And I think we're better off with it than without it. The second prong of certification and accreditation is board certification. As anybody who practices in the center, are they all required to be board certified? Are the anesthesia providers either certified registered nurse anesthetist or board certified anesthesiologists? Are all the surgeons or anybody that performs procedures in these places, are they all board certified? So don't think, well, this is just my hand, so my surgeon is the only one that matters, that he should be board certified in the area that he's working. I don't think so. I would posit the argument that it speaks to the integrity of the ownership if everybody who's performing procedures in that place is required to be board certified. And then finally, there's advanced cardiac life support certification and pediatric PALS, pediatric advanced life support certification. So most places will require that the nursing staff and the anesthesia personnel have advanced cardiac life support certification. But if I were bringing a child to one of these places, I would ask if somebody is PALS, certified pediatric advanced life support. There are cases of children who have died because they were in a place where they needed to be resuscitated and nobody in-house had PALS certification. I spoke in my last video on sedation in a dental setting about the fact that children are not just small adults. And I think that PALS certification is very important in doing PEDS cases. A third consideration to discuss with your surgeon and think about on your own is transfer time. How far are you from the hospital? I noticed that in some of the cases in the U.S. News and World Report publication were cases where there was like a 40-mile stretch between the ambulatory center and the hospital. Now, nobody schedules you for ambulatory surgery planning to send you to the hospital, but the reality is you might have to be transferred. And I'm not saying I wouldn't do anything out in a rural setting. I might do my cataract surgery in a rural setting where I knew I was going to be very awake. You know, you're not under a sedation usually, or you don't have to be for a cataract surgery, and it's a very minimally invasive procedure, but overall, I would give a great deal of weight to that consideration. I really wouldn't want to be out in the middle of rural North Dakota, 40 miles from a hospital, and in the event that I had to be transferred, that time might really be the determining factor in my prognosis. Now, the final factor I want to recommend that you consider is called procedure complexity. So I did read a cluster of these cases had to do with a procedure complexity, namely with cervical spine surgery. Cervical spine is up here, it's the back of your neck. And I don't want to get into too much technical detail, but the back of your neck is pretty close to the front of your neck, and this is a very tight area that encompasses the surgical site, but also your airway. There were several of these cases where patients died after cervical spine surgery, and in my opinion, if they had been in a hospital environment, I don't think it even would have been a thing. I think that kind of surgery, at least for now, I think that it requires monitoring over a longer period of time and overnight. These are kind of new, highly complex procedures, didn't used to be in the ambulatory settings. They're just kind of recently creeping in there. So yeah, the cervical spine is just one of them, and maybe in a few years we'll have done a lot of them and I'll have a different opinion. So how do you know, that's only one kind, how do you know that whether your surgery is particularly complex? Well, that you have that discussion with your surgeon, and like I said, complex surgeries in the ambulatory center is kind of a new thing. So if you ask your surgeon, how long have you done this surgery in the ambulatory setting, you should hear a satisfying number. Like we've been doing this for 15 years in the ambulatory setting, and we have good outcomes with that. So try to get a sense of whether your procedure is particularly complicated. And this is also one that you might want to talk with your primary doctor about, because your primary doctor has this bird's eye view. And by that, I mean he or she has had the hindsight of having had many patients have these procedures in many places with many different surgeons, and that provides a certain kind of bird's eye view that you might really benefit from if you have that discussion. So I hope this was helpful. If you have any comments, feedback, please put them in the comments section. Also, if you have any suggestions on topics that you would like to hear about in the future, please let me know in the comments section. I hope that you'll consider subscribing, because that's how I know that this is worth doing. And until then, until next time, thanks for having me. Bye-bye.